Hello and welcome. Today we're going to break down a condition that a lot of people have heard of but maybe don't fully get, shingles. And believe me, it is so much more than just a painful rash. In fact, its story starts decades, yes, decades, before the first symptom ever even shows up.
Welcome to MediByte, the place where we make complex health topics simple. Today, we're diving deep into shingles, which you might also hear called by its medical name, herpes-zoster.
All right, let me start with a quick question for you. Did you have chickenpox when you were a kid? I bet a lot of you are nodding right now. You probably remember those super itchy spots, maybe missing some school. For a lot of us, it was just a normal part of growing up.
Well, here's the plot twist. If you answered yes to that question, then the virus that causes shingles is already inside your body. It's just sleeping. This is probably the most important thing to understand. Shingles isn't a new bug you catch. It's the ghost of that old chickenpox infection coming back to haunt you.
So let's really dig into this connection, right? How on earth can a childhood sickness reappear decades later and cause a totally different problem? It all comes down to one incredibly persistent virus that's an expert at playing hide and seek.
So check this out. Chickenpox and shingles, they're basically two acts of the same play, starring the exact same virus, varicella-zoster. Think of chickenpox as Act 1, that's the initial infection, and shingles, that's Act 2, when the virus decides to wake up and make a comeback years down the road.
Okay, so let's trace this virus's sneaky journey. First, you get chickenpox. The rash clears up, you feel better, and you think it's over. But it's not. The virus pulls a clever move and retreats into these nerve cells right near your spinal cord, where it just hangs out, totally dormant, for years, even decades. Then, for reasons we're still figuring out, often linked to stress or a weakened immune system, it wakes up. It reactivates, travels down those same nerve pathways, and boom, erupts on your skin as shingles.
So, you're probably wondering, how likely is this to happen? The numbers are actually pretty surprising. About 1 in every 3 people will get shingles in their lifetime. That's a pretty high number. And that risk? It goes way up as we get older. By the time a person hits age 85, their chance of getting shingles can be as high as 50%. Why? Well, it's mostly because our immune systems tend to get a little weaker over time, which gives that sleeping virus the perfect opportunity to stage its comeback.
Okay, so we know where it comes from, but what does a shingles outbreak actually feel like, and what does it look like? As you're about to see, it is definitely not just a simple rash.
The way it unfolds is usually pretty typical. Weirdly, it often starts not with a rash, but with pain, or a tingling or burning feeling on a patch of skin. And here's the key. It's almost always on just one side of the body. A few days after that starts, you'll see these clusters of little blisters pop up. And then over the next several days, they'll eventually dry out and scab over.
You know that classic shingles look, that distinct stripe or band of rash? Ever wonder why it looks like that? Well, there's a really cool medical reason for it. It's called a dermatome. Since that reactivated virus travels down one single nerve from your spine, it only affects the area of skin that specific nerve is connected to. And that's what creates that famous one-sided stripe. Pretty neat, right?
Now, while most people get through shingles just fine, we have to talk about the fact that some serious complications can happen. For example, if the virus hits a nerve that goes to your eye, it can be really dangerous for your vision. If it affects a nerve near your ear, it can cause something called Ramsay-Hunt syndrome. And then there's the most common complication of all, a type of long-lasting pain that we're going to talk more about in just a minute.
But let's get to the good news. Shingles can be really painful, for sure, but it is very treatable. The key, though, is catching it super early.
Seriously, if there is one thing, just one, that you take away from this entire explainer, let it be this. If you get a weird, painful, tingly rash on one side of your body, call your doctor, immediately. Getting treatment started right away makes all the difference in the world.
So what does that treatment look like? Well, the main weapon we have is antiviral medication. It helps make the outbreak shorter and less severe. But, and this is a big but, you have to start taking it within the first 72 hours. That's 3 days of the rash appearing for it to work best. After that, it's about managing the pain and using simple things like cool compresses to help soothe your skin.
All right, let's wrap this up by talking about the absolute best strategy, prevention. And we're also going to take a closer look at that lingering pain complication I mentioned earlier.
Okay, so that complication is called post-herpetic neuralgia. Let's just call it PHN. For some people, even after the rash is totally gone, the nerve pain just stays.
And this isn't just a little ache. It can be severe, it can be debilitating, and it can go on for months or even years. It's the most common and feared long-term problem from shingles.
About 10% of people who get shingles will end up with PHN, and just like with shingles itself, the risk is way higher for older adults. This right here is the main thing that both doctors and patients really want to avoid.
The best news of all, we have an amazing tool to fight back against both shingles and PHN. It's the vaccine. The modern shingles vaccine is recommended for all healthy adults age 50 and over. It's a 2-shot series, and it is incredibly effective at keeping that dormant virus from ever waking up in the first place.
So that really leaves us with the final question to think about, doesn't it? We have this incredibly safe and effective vaccine that can prevent all of this pain and suffering. So what's the biggest hurdle? What's stopping more people from getting the protection they need?
I really hope this breakdown of shingles was helpful for you. If it was, do us a favor and hit that like button. And be sure to subscribe to MediByte for more clear health explainers just like this one. Thanks so much for watching.